Have you ever discovered a lump under your skin and instantly felt a wave of panic? Your mind races. Is it cancer? Is it dangerous? Or is it just a harmless bump? You're not alone. Millions of people find mysterious lumps every year, and most have no idea what they're dealing with. Today we're going to clear up the confusion once and for all. By the end of this video, you'll know exactly how to tell the difference between a cyst, a tumor, and a lipoma, and when you should actually worry. Let's face it, the word lump is scary, but not all lumps are created equal. Some are completely harmless, while others need urgent medical attention. The problem is, they can look and feel very similar. That's why understanding the difference between a cyst, a tumor, and a lipoma isn't just interesting. It could literally save your life. So, if you want to stop guessing and start understanding your body, keep watching. Let's start with cysts. Imagine a tiny balloon under your skin, filled with fluid, pus, or even semi-solid material. That's a cyst. Cysts can form almost anywhere in your body. On your skin, in your organs, even in your bones. Most cysts are benign, meaning they're not cancerous. They often develop when a gland or duct gets blocked, trapping fluid inside. The most common types are sebaceous cysts, which form under the skin, and ovarian cysts, which develop in the ovaries. Here's something you might not know. Many cysts can actually be popped or drained by a doctor. But don't try this at home. Squeezing a cyst yourself can lead to infection, scarring, or even make things worse. The key symptoms of a cyst? It's usually round, smooth, and moves slightly when you press it. It might be tender, but often it's painless until it gets infected. Now, let's talk about lipomas. If a cyst is a balloon filled with fluid, a lipoma is more like a soft, rubbery marshmallow under your skin. Lipomas are made up of fat cells, and they're the most common type of soft tissue tumor. But here's the good news. Lipomas are almost always benign. They grow slowly, are usually painless, and feel soft and squishy to the touch. You can often move them around a little under your skin. Lipomas can appear anywhere, but they're most common on the neck, shoulders, back, arms, and thighs. They rarely turn into cancer, and most people never need to have them removed unless they're painful or bothersome for cosmetic reasons. Did you know lipomas can run in families? If your parents or siblings have had them, you might be more likely to get them too. But don't worry. Having a lipoma doesn't mean you're unhealthy or at risk for something serious. Now, let's address the word that scares everyone: tumor. The truth is, tumor simply means an abnormal growth of tissue. Tumors can be benign, non-cancerous, or malignant, cancerous. This is where things get serious. Unlike cysts and lipomas, tumors can grow aggressively, invade nearby tissues, and sometimes spread to other parts of the body. Benign tumors usually grow slowly and don't spread. Malignant tumors, on the other hand, can be life-threatening if not caught early. The tricky part? Sometimes only a biopsy or imaging test can tell the difference. Here's the scary part. Some tumors don't cause any symptoms until they're quite large or have already spread. That's why it's so important to get any new, growing, or unusual lump checked by a doctor, especially if it's hard, fixed in place, or rapidly increasing in size. So, how can you tell what kind of lump you're dealing with? Here's a quick breakdown. Cyst, usually soft or firm, round, and moves slightly under the skin. May have a visible head or opening. Can be tender if infected. Lipoma. Soft, squishy, and easily movable. Feels like a lump of dough or rubber. Usually painless and slow-growing. Tumor. Can be hard or firm, sometimes irregular in shape. May be fixed in place and not move when you press it. Can grow quickly and may be associated with other symptoms like weight loss, fatigue, or unexplained pain. Here are the warning signs you should never ignore. The lump is hard. irregular, or fixed in place, it's growing rapidly. It's painful. Red or hot to the touch, you have unexplained weight loss, night sweats, or fever. The lump is deep inside your body, not just under the skin. If you notice any of these, see a doctor right away. Early detection can make all the difference. Whatever you do, don't try to diagnose yourself with Google images or by poking and prodding the lump. And never try to cut, pop, or drain a lump at home. This can lead to infection, scarring, and even more serious problems. When you see a doctor, they'll start with a physical exam. They might order an ultrasound, MRI, or CT scan to get a better look. In some cases, they'll take a small sample, biopsy, to check for cancer cells. Most of the time, cysts and lipomas can be diagnosed just by touch and appearance, but tumors often need more investigation. Cysts may be drained or removed if infected or bothersome. Lipomas, usually left alone unless they're painful or unsightly, can be removed surgically. Tumors. Treatment depends on whether they're benign or malignant. Benign tumors may just be monitored, while malignant tumors require surgery, chemotherapy, or radiation. Strong hook, real-life story. Let me share a quick story. A viewer once messaged me about a lump on his neck. He thought it was just a cyst, but it kept growing and felt hard. He saw a doctor, got it checked, and it turned out to be an early-stage lymphoma, a type of cancer. Because he acted quickly, he got treatment and is now cancer-free. The lesson? Don't ignore what your body is telling you. So, to recap, not all lumps are dangerous, but all lumps deserve your attention. Cysts are fluid-filled and often harmless. Lipomas are soft, fatty, and almost always benign. Tumors can be benign or malignant, and only a doctor can tell for sure. If you find a new lump, don't panic, but don't ignore it either. Your body is always talking to you. Listen to it. If you notice something new, unusual, or changing, get it checked. Early action can save you from pain, worry, and even save your life. If you found this video helpful, share it with someone who needs to hear it. Drop your questions or experiences in the comments below. And don't forget to like, subscribe, and hit the bell for more health tips that matter. Stay curious, stay safe, and always trust your instincts.